So in the relapsed and refractory myeloma setting, after you progress on a proteasome inhibitor and an immunomodulator like lenalidomide, pomalidomide is the next funded option. Certainly, pomalidomide and dexamethasone only provided a progression-free survival of about 4 months, and so it would be nice if we could add another option in combination with pomalidomide and dexamethasone that provides a better outcome for patients. So Selinexor is a blocker of exportin 1, which really regulates apoptosis. And so this study has two parts. The phase 1 is really looking at the dose finding portion of Selinexor in combination with pomalidomide and dexamethasone, and that's what this poster reported on. The second phase of the study would be phase 2, looking at once you find that maximally tolerated dose, combining it with pomalidomide and dexamethasone, and then seeing the results and the safety analysis from there. The finding that maximally tolerated dose is still ongoing as part of the study. Interestingly, the side effects are not unusual for what you find with Selinexor in this first early part of the study, with a lot of the GI side effects, anemia and neutropenia. As we would hope and as we would expect in the initial parts of the study, the outcome does look better when you add Selinexor to the PomDex backbone. Again, normally you expect about 4 months of efficacy, and when you add the Selinexor in POM-naive patients, it looks like you get about 12 months, which is what we'd expect for current options such as adding cyclophosphamide to pomalidomide and dexamethasone. Well, I think some of that right now is certainly finding what that maximally tolerated dose is and seeing if we can find that dose that limits a lot of those known side effects that come along with Selinexor. This part of the trial was certainly just the early phases dose finding. The phase 2 will go into taking that maximally tolerated dose, combining it with PomDex, and then certainly getting those safety results in the specified patient population. So from there, it'd be interesting to go on to a phase 3 if the results are warranted. It's always nice to be able to have combinations. We definitely know that that's what we need now in treating multiple myeloma patients, particularly in this setting, multiply relapsed or progressive disease, and having something to combine with pomalidomide and dexamethasone is definitely an advantage for patients.